More Western nations are ignoring a call by the WHO to stop offering COVID-19 booster shots so the doses can be distributed to poorer nations. France says it will give boosters to the elderly and vulnerable from next month. The US has already said it won't abide by the WHO's call.
If we feel that it's a false choice and that we can do both. We announced just yesterday that we hit an important milestone of over 110 million vaccines donated to the world. That is more than any other country has shared combined. We also, in this country, have enough supply to ensure that every American has access to a vaccine.
The WHO wants richer countries to put boosters on hold for 2 months. It says this will give poorer countries some time to get their hands on the limited global supply of vaccines. The UN Health Agency wants 10% of every country vaccinated by then. But widening inequality may hinder that goal. Richer nations have scooped up more than 80% of doses, though they make up less than half of the world's population.
I understand the concern of all governments to protect their people from the Delta variant. But we cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it, while the world's most vulnerable people remain unprotected.
And if we continue to put strain on vaccines by now going into third, fourth doses or whatever in areas that already have high coverage, we just will not be able to catch up.
Infectious disease expert Dr. Sanjay Senanayake explains why the world needs to help poorer countries get vaccinated.
There may be groups of people who do need a booster shot. So in France, they're giving a third dose to people with low immune systems because by virtue of their low immune systems, they may not be able to get a very good immune response to the vaccines. But I think at the moment, it's not necessarily clear that otherwise healthy people need to have the third shot. The other important thing, talking about the rest of the world, you have Africa at the moment, a continent of 1.2 billion people, where only around 1 or 2% of the population have been fully vaccinated, and Delta is running rampant in some regions. The reality is this: if we don't control or get people in Africa vaccinated at the moment, then a worse variant may appear, and the current vaccines, even with a booster, may not make a difference. We all know that COVID is a very sensitive issue, and particularly for countries who've had big outbreaks of COVID, like a lot of Northern Hemisphere countries, they do want to ensure protection of their people. But I keep saying that if you want to be selfish about COVID and protect your own country, you have to be selfless and make sure the rest of the world has equitable and timely access to vaccines as well.